Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm with my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I am doing fabulous, kind of anticipating the holidays coming up.
Yes, I just hosted a large group of small children at my house making gingerbread. And so the last couple nights I was up late making little tiny gingerbread houses for them to decorate. And it was an absolute blast, like sheer chaos from start to finish, but nothing but fun and sugar, and nobody barfed. So that's good. But that was my my holiday extravaganza weekend. So good things, all good things.
Very good. We have got two fabulous guests today from the Des Moines University College of Podiatric Medicine and Surgery. I'd like to introduce from the class of 2027, Kenny Hall-Johnson. Kenny, welcome to Dean's Chat.
Hi, thanks for having me.
Oh, you're so welcome. And from the class of 2028, I'd like to introduce George Mikhail. George, welcome to Dean's Chat.
Hello, thank you for having us.
Oh, you're so welcome. I wanted to show you guys something before we get started. This was a gift from your dean to me, the Des Moines University pullover, and I can't wear it in public, right? So I told Dr. Smith I'd wear it after I retire, but it was very kind of him to send it to me. So
you should like have someone sew two of them together, and you could like wear two colors at the same time.
There you go, like my Packers and Broncos.
Yeah.
Good idea, actually.
Who played this weekend?
They did. Kenny, I'm still hurting over Micah Parsons' injury.
Yeah, that's a tough one. It was like, I think within that couple of minutes span, there was like a couple of injuries. They also, a Chiefs quarterback went down, Patrick Mahomes with the ACL tear. So it just back to back. It's like, wow, like 3 or 4 people went down that same, I guess, time frame.
It's crazy. NFL, man, 17, 18 games. They're going to get hurt sooner or later. All right, well, let's get started. Joe, take it away.
Yeah, so we're so excited to have you both. Thank you so much for coming to represent the Des Moines University College of Podiatric Medicine and Surgery. We'd love to first get a little bit of a feel from each of you, where you went to undergrad and what you got your degree in, how you found out about podiatry, and maybe what kind of brought you to Des Moines. We'll start with you, George, and then we'll move to Kenny.
Absolutely. So I was born and raised in Georgia. I completed my undergraduate degree at Georgia State University. I got a neuroscience bachelor's degree. And from very early on, I've always knew I wanted to do medicine. I was very drawn to anatomy, physiology, and especially surgery. That was kind of like the big thing for me. And I kind of just enjoyed how, structure and function, they kind of like translate directly into how someone lives their daily life. So kind of what ultimately led me to podiatry was realizing how much foot and ankle influence with everything else. The first time I heard about it was I went to a doctor. I had feet problems, and I didn't know he was a podiatrist, not at all. Didn't even look at his initials, the abbreviations behind the doctor's name. And lo and behold, found out he was a podiatrist, went to podiatry school, kind of learned about it. Ended up having metatarsus abductus in my left foot, which was causing me a little bit of pain. So kind of through that experience, I learned a little bit more, being a patient, as well as kind of shadowing a little bit more with podiatrists, learning about the profession. And I kind of started to see how podiatry became a very unique intersection of surgery and biomechanics and long-term patient care. So the more research I did, the more I talked, learned about training and scope. It's kind of what ultimately brought me to podiatry.
Oh, I love that. And then from Georgia to Des Moines, that was a pretty notable move. What was some of the behind that?
Yeah. It was a pretty big move. 16-hour drive. Had to stop in St. Louis, kind of midway. Didn't really make that long of a drive before in my life. More of a 7-8 hour type of guy. So this was double. But kind of checked out the city. It was a little bit quiet. Kind of reminded me of where I grew up here in Georgia. So kind of reminded me of home. So decided to go to Iowa.
Love
Don't know
it.
about the snow
And
though. So
I was just going to ask, being a non-snow person, moving to a place with snow, was that a hard adjustment? Like for other students that maybe are thinking, oh, if I wanted to pick a school, how was that adjusting for you?
I'll tell you a funny story. It was February of this year. I think the snow came maybe a little bit late. Uh, I didn't know it was ice or anything. It kind of rained. I was going to school to study. I was walking in my driveway and I slipped and fell. So
Oh no.
ended up in the ER that night, and I had a cardio exam the following week. So it was a little bit of a kind of an obstacle, but also a funny experience because I got it recorded on my Ring camera. So I just laugh at it every time.
Oh, that's great. Thanks so much for sharing. How about you, Kenny? Tell us a little bit about your where you went to undergrad, what you got your degree, and then how you found out about podiatry and the Des Moines draw for you.
Right. So mine's a little different from my colleague George. I'm more of a non-trad student. So I went to undergrad at Texas Southern University. I was an athlete, played football. And I say a couple of weeks before I graduated, I figured out after shadowing a few doctors down there, so I actually had my foot operated on during my senior season. And I was like, oh, I actually like this pathology. I like how this is ran. And I was like, I want to be a doctor. So from there, I took my talents to Pittsburgh at graduate school, and I basically rebuilt my pre-read resume to basically become a physician. And over that time span, I got to shadow a multitude of different professions, and podiatry was one of them. And then I basically applied later on, and then I got into Des Moines University. That's the
So that's nice. So Texas gets a little sleety, kind of well, depending, I guess, on the part of Texas, a
right.
little bit of like snowy ice, but Pittsburgh definitely gets some snow. So not too much of a change for you from a weather perspective. We're all about weather here in Arizona because people love to talk about how hot it is, us included. So,
Right.
so not too hard of an adjustment for you.
No, I grew up in Plainfield, New Jersey, so it wasn't. I'm
Okay.
used to the cold, but it's the difference between Iowa and Pittsburgh cold. So it's definitely
Yeah.
still a little bit of an adjustment, but yeah, I managed well.
Awesome.
Very good. I wanted to delve into the shadowing experience a little bit. You were both patients of podiatrists, but when you really got serious about looking into podiatry as a career, can you kind of share what that shadowing experience looked like or how many docs you went to? You can even do a shout out if you want. George.
Yeah, absolutely. So I shout out Dr. Bahika. He was my doctor and he's the one who treated me. Very great guy. He answered all the questions I had. I didn't know what was going on. And so kind of overall, like kind of what drew me more to podiatry was with the shadowing experiences and kind of talking to him more. He was kind of my mentor throughout it as a patient, but also kind of just talking outside as a patient. So sometimes I'll go visit here and there. And it's kind of what's nice about it with like podiatry, it kind of directly preserves the patient's independence in a way. So it's kind of whether it's like a children learning to walk or an athlete is returning back to sport, kind of like Kenny, or being a diabetic patient trying to stay mobile throughout. It's kind of, foot and ankle health isn't abstract. It kind of determines whether someone is able to work, they can care for their family, or like live independently. So that level of responsibility kind of really resonated with me, as a patient trying to get back, playing sports again and kind of doing what I enjoy in my life. And it kind of just made me really proud to pursue this field throughout. So
it's a great story.
yeah.
Kenny, let's talk about your shadowing experience a little bit.
So mine was a little different also, because the first shout I want to give out to Dr. Tomiko Fukuda down in Texas Orthopedic down in Texas. She's actually an MD, foot and ankle specialist, but I also saw multiple podiatrists down there. I just didn't know what I was looking at the time. But my main shadowing experience was in Pittsburgh at West Penn with Dr. Canzariti and Dr. Hinches. So those two where it was like the solidification of like, wow, this is what I want to do.
That's fabulous. I'm going to do a little tour back 30 years ago. I was seriously considering Pittsburgh and Dr. Canzariti and Kern and the different programs that were available. That's been a phenomenal program forever.
Phenomenal program. I was very happy when I saw. I think I just got accepted at DMU at the time, and I went to shadow there thanks to Dean Smith. And I was like, this is phenomenal. And I was like, I really like this program. I like this profession.
That's great. I can appreciate the ambulatory thing. I have a new appreciation for getting around, because I had knee surgery in July, and it's no joke, right? I mean, if you can't walk around and do the things you need to do, activities of daily living, it severely impacts your ability to function. So I have a new appreciation for that. In fact, I've been in a couple airports and I've told Joe I have like knee envy, because I look around and everybody's walking around feeling great and my knee hurts. So it's getting better though. All right, Joe, your turn.
All right. So while we're still kind of in this idea of what it's been like, some of the transitions you guys have had going from undergraduate to graduate or graduate to medical graduate type training program, we'd love to get your take on what you wish you would have known prior to starting podiatric medical school. Anything maybe that surprised you about the education, either positive or, man, I wish I was more prepared for something. But what advice or what would you kind of tell a prospective student about things that you wish you would have known prior to starting? Kenny, we'll start with you and then we'll go back to you, George. We're going to bounce around a little bit.
Sure thing. I was pretty prepared of the task at hand of medical school in general, but I don't think people understand that the time slot that you need for medical school. So I was still kind of a culture shock coming to medical school at Des Moines, because I was expecting to be in the same level as the DOMD counterparts, and it legit is true. So I was still a little bit unprepared of like, wow, this is actually a lot of volume of information. But other than that, I'm very pleased of the education I'm having here at Des Moines University.
Yeah, certainly Des Moines is a fully integrated program like we are at Midwestern. And you're absolutely right. I think that's one of the things that shocks several students is it's a full-time job being a podiatric medical student. So I could definitely appreciate that just from a time blocking and studying. And it's not just going to school, but then it's all of the other things that go with it.
Right. That's why I also say, like, I had a meeting with some prospective students at a school virtually, just like this. And I was like, just once you get in medical school or a professional school, especially medical school, just have fun before you get here. Because once you get in, it's really full go from there on. So you'll get a little break after first year, but from there on, you're on the clock and you're basically training to be a physician. So just have your fun. As a prospective student, you'll be fine. We all get through it. I've talked to George before this. We all get through it.
Yes.
Just keep grinding. And then, like I said before, have as much fun as possible prior to, the August or July start date.
And I would say the same thing for residency. In between school and residency, go have all your fun. And like these little, chunks of sustained effort, enjoy those downtimes. Like fill your cup with all the things that bring you joy. All right, George, how about you? What was something that maybe surprised you or something you wish you would have known prior to starting school?
To be honest, kind of the one thing I wish I understood easier is how different the mindset shifts from undergrad to podiatry school. So I feel like in undergrad, a lot of learning can feel kind of compartmentalized, and you kind of study for an exam, you move on, you reset. But in podiatry school, it's kind of everything is building on itself. You're really kind of laying a foundation, and then you'll rely on clinically for years. So I kind of learned pretty quick, and Kenny has been a great mentor to me throughout my start at DMU. And he's the guy I go to, and he always tells me, get on with it, let's go. So he's kind of like, I feel like my personal coach here, like building me into a nice athlete. But kind of just learned really quickly, the efficiency matters just as much as effort. You can't really just study the same way you did before. You have to be very intentional. You have to be organized. You have to be willing to adapt, because some classes are different, than others. And so kind of once I started viewing the material more from the standpoint of a clinical lens and thinking about how it would apply to real patients, things kind of began to click more naturally. But yeah.
Yeah. Oh, I love that one, because that's certainly something we've seen too. Students will say, what makes a student successful? And you're right. Everything is intentional, and it's building stuff that you're going to take and carry with you for the rest of your career. And so understanding how those pieces all work together, that's a really beautiful reflection. So thank you for sharing that.
I want to add one more thing, if you don't mind. And
Yeah.
I talked to George about this as well. It's just like, and this is for prospective students and current students. And I had to learn this, a little bit of the hard way, not too much, but it's like when you're in medical school and something happens, adjust confidently. Where it's going to be times where, whether good or bad, it's going to have some adversity coming. So it's very important that you keep your mental health as clear as possible and just adjust confidently. So if things happen, like you don't do too well on an exam, just go into the next one and say, okay, I just adjust. is to stay focused and just go from there and get the job done. You'll be fine. Everyone's fine. George, George, I've talked to you multiple times about this, but yeah, that's one of my big things to tell everybody. Just adjust confidently, you'll be fine.
Yeah, he always tells me that you'll be fine. You'll be fine. Don't worry.
Positive reassurance is
Yes.
really needed and validating sometimes. I'd love to piggyback a question for you then, Kenny. Being a student athlete as well, I find that our athletes have a very good perspective on this idea of being able to focus on the next play, right? Like sometimes you got to let it go and move forward. Or as my favorite Ted Lasso, right? The memory of a goldfish, right? The happiest person on earth is the goldfish, like be the goldfish. Do you feel like that was something that helped you with that adjust confidently mentality? Yeah.
So you're talking to an ex left tackle for a D1 school. So I've had great games. I've had bad games on national TV, and I've false started on national TV. I've given up sacks on national TV, and the game still goes on. So, at the end of the day, see if I false start, I give up a sack and we have to still score, I'm still lining up and it's still a silent count. I still have to get my job done. So the memory of the goldfish is immediate, where it's like, okay, I know what happened. I'll get yelled at on film and within the next couple of hours. But for right now, it's mano a mano against the 9 technique. And it's just right back to the grind.
I love that, because shaking off that psychological part, because to your point, George, everything builds. And what can get hard, I think, sometimes for our students, and this is where I'll switch to my own eye language of when I was a student, that weight of maybe you didn't perform the way you had hoped to, and whatever that looks like for you, right? We have perfectionist students that didn't get 100% and they feel this weight on them. There are students that maybe didn't pass an exam. It's one moment, right? And to your point, Kenny, just move on. It's like you got to find a way to just pivot. I like your pivot confidently, and find a way to just keep moving forward, because the end game, that's the primary target.
Precisely. Don't compare yourself to anybody else. Just back on the line. Get ready.
I love that.
I love talking resilience and the analogy with sports, because you always say, what's the most important exam? The next exam, not the best one. So there's a lot of analogies there. When we've it's funny, I've talked to Dr. Smith about this. We love getting student athletes. We love bringing people into the colleges that already have time management skills, because really medical schools, an exercise in time management. Next question for you. You both have touched on this briefly, but what are you most excited about in podiatry as you look forward to the next 10 years or so? George, let's start with you.
I think the biggest one would be, I feel like, just AI, kind of how things are. But the biggest thing is how the field is very much evolving at the intersection of surgery and the technology and like the patient-centered care. Podiatrists are playing an increasingly important role in limb preservation and sports medicine, and managing kind of the complex conditions like diabetes, where timely intervention can completely change a patient's quality of life. So I'm really excited about the advancements in surgical techniques and the biomechanics, and all of the interdisciplinary care are allowing us to, treat patients more efficiently and prevent problems before they become life-altering is kind of a big one. If a patient is, being diagnosed as a diabetic, and this is kind of early on, being able to, hey, go see a podiatrist, because a lot of this can involved with neuropathy. So I feel like with all this timely intervention, it does change the patient's quality of life. I'm excited about how the advancements are for surgical techniques and the biomechanics, and all this is going to allow us to treat patients more efficiently and effectively. I think one thing that I've seen is like at DMU, we're starting to do like VR surgical, kind of being able to wear that and practice. So I've seen the faculty do like Dean Smith and all that. So kind of excited we get a chance to do that. But being able to, combine technical skill with long-term patient relationships is something that I find, incredibly motivating. So overall, I'm excited to be a part of this profession. It's growing, it's adapting, and it's continuing to prove how essential foot and ankle care is to overall health.
Well said. That's kind of mic drop-ish. I love that. We may have to take a little snippet of that and put it on a short. Well done. Kenny, what are you most excited about in podiatric medicine and surgery on the horizon?
I think 2 things. I think the first thing is, obviously, we discussed this constantly with Dean Smith, is the parity of the field itself is growing. overall. But I'm also excited about the new innovative ways we get to treat patients in the operating room. For example, I saw Dr. Dykes's Pod Patrol episode about the osteo, and then a couple of weeks ago, or actually a couple of days ago, I saw osteo being used in the operating room. So, and as podiatrists, we get to utilize these type of things in the future. And then, George and I are younger physicians coming up, at the future's bright for what we're doing in the operating room. So I'm very excited to see with the new techniques, the new jigs, the new devices we get to utilize in the operating room to help our patients.
It's great because social media and technology helps us see it in person. And we can, not in person, but virtually through YouTube videos and things. So it's an exciting time. You guys don't have to put yourselves on mute. The software technology is such that if there's background noise, whoever's talking gets the predominant floor, if you will. So no problem. All right, Joe, your turn.
All right. So we'd love to, we'll take a quick break in a second to hear from our sponsors. We'll shout them out, but we'd love to hear a professor shout out from each of you. So maybe if you can give us a didactic faculty from like the first 2 years, and then any clinical faculty with Des Moines that you would like to shout out. George, we'll start with you.
Yeah, so I'm shouting out Dr. Johnstone. He's a podiatry faculty. He has a depth of knowledge and passion for like history, and he always like knows the root words of things and kind of just gives us a nice history lesson and kind of adds perspective to what we're learning. And two more shout outs is to Dr. Warning. She's been incredibly helpful in anatomy, and Dr. Schmidt, who's been great with Foundations 1 and the basics of biochem and genetics and all that good stuff. So, but yeah.
Fantastic. And Kenny, how about you? Professor shout-outs.
I would say Dr. Watson for pharmacology. I think he's been a breath of knowledge since I got here. When we took the course, it's in terms of office hours, he was very open for it. He was very thorough in his explanations. And for clinical, I have to say Dr. Sean Grambart. Again, breath of knowledge. He has a very particular way of teaching, and it's very you have to adjust to it because it's very you learn really well when he basically we call it pimping. I don't know if I can say that, but that's what he calls it. But it's you do learn a lot, and he has again a breadth of knowledge, and he's always there. He's always a phone call away, always a text away, and his contribution to DMU was very, very apparent, obviously.
That's wonderful. We'll take a quick break to hear from our sponsors, and we'll be right back.
Did you know APMA provides help with public health initiatives such as fall prevention, opioid abuse prevention, and addressing health disparities?
Did you know the APMA provides over $400,000 in scholarships annually to students pursuing podiatric medicine, helping the next generation of foot and ankle specialists?
If you're serious about this profession, if you want to grow, to lead, to make a lasting impact, join APMA today.
All right, welcome back, everyone. Wanted to get into some of the meat and potatoes about the American Podiatric Medical Students Association. Kenny, that's how we first met.
Right.
And super curious about how you got involved and what your current roles are, and how that relates to your classmates and the profession as a whole going forward. George, if you don't mind going first.
Yeah, absolutely. So I wanted to run for APMSA. I'm very passionate about podiatry, so I feel like there's a lot of work to get done, and kind of one of the biggest things is kind of the parity was a big one for me. Kind of just showcasing how important podiatry is within medicine, and projecting how things are with the future with patients. So the other thing is I didn't get a chance to go to the first conference, but I am going to the second one, so I'm pretty excited on that. But I wanted to really get involved by connecting with classmates and mentors and kind of encourage engagement beyond the classroom. So being able to serve as a delegate kind of allowed me to represent my class in a way, communicate national updates, bring any student concerns and ideas to the table. So kind of just helps me grow, not just as a student, but a collaborator and communicator for the field, for podiatry field.
Now, as a rep, George, are you a liaison to another group in the profession?
No, I was voted in as just the APMSA delegate, class
Oh,
delegate for 2028. So
got it. Okay, well, thank you. All right, Kenny, your background, and you're not shy. I know that. You got involved and you do a lot of things. And if you don't mind sharing your journey in APMSA with us.
Right. So my journey was actually, quite simple, like, rather simple. I wanted to again build the parity of podiatry, and I said, why not start with the Student Government Association? So I started as SGA president, and then when I got to the first ACFAS last year, I was like, you know what, I'm going to run for president committee chair, and I overwhelmingly won. I was excited for the opportunity, so I'm the APMSA president committee chair. Basically, that means I'm the presidents of all the presidents of the various schools, and we basically all work together with like the board of trustees to basically further parity for prospective students in the field of podiatry in general, especially for the students. So we have new innovative ways of reaching students, like the podcast coming up, various ways of handling scholarships. So it's a very exciting portion of what I do as a student.
I like that. And I can tell that you've got the podcast vibe going, Kenny, because you've got the best looking microphone I've seen on Teens Chat in almost 3 years. So how's that going? I know you and I and Joe have talked about it. We've given some advice, and I know Dr. Dykes has been very generous with advice too. How's the podcast going?
Going well. It'll be up sooner. I would say sooner rather than later. We still haven't have a release date yet, but it's on the come up.
Oh, that's great.
Yeah.
Well, it's always good to have a few in the bank, right? Because then you're not stressed each week to get one out.
Right.
All right.
Yes.
Very good. Joe?
So I'd love to know, and it can be either in the spectrum of your APMSA leadership, things that you're excited about, or something about the journey of you're in podiatric medical school right now. You'll be getting ready to graduate, residency, fellowships, work, careers. What is it about the journey that you guys are the most excited about? Kenny, we'll start with you.
I think I would say I'm always just, again, for podiatry in general, I'm just excited because, like, again, it's hard to basically put into perspective what you're going to be doing when you're the first 2 years of school, because you're stuck in the classroom or on a screen. But when you go into OR, like I was recently, it's like, oh, this is what I'll be doing. And then just to see that the development of like even former alumni go from their background to now, it's like, okay, this is how a podiatrist works. And so that's basically just excited for the future in general of practicing as a physician. That, if I answered the question.
Do you have a mentor that you guys pair with in your school? Either like an upperclassman. George, you had mentioned Kenny was kind of a mentor-ish person for you. Do you get paired up with someone or a faculty mentor?
It depends. We have like a big little system here as well.
Okay. And
also we have like advisors. So my advisor is Dr. Grambard. And then I don't think I have one. Yeah, I do have a big. He's on 4th year rotation. So and most of our 4th years now that are on rotations are very open to answering all questions. So it's a very good mesh of people that you can actually bounce ideas off of.
That's great. Thank you. How about you, George?
Yeah, I mean, for me, what I'm kind of particularly looking forward to is the training. I'm kind of continuing to connect foundational knowledge to real patient care, especially seeing how anatomy and biomechanics and pathology kind of come together clinically. So, being in second year, just finishing up kind of the classes and preparing for boards coming up. So, but here at DMU, the second years, we kind of just start rotations right away in Iowa, kind of the end of May-ish. So that transition, from theory to application is one of the most exciting parts of podiatry training. So I'm really excited about that. And as a profession long-term, podiatry is a specialty that, continues to prove how essential it is to overall health. I mean, with the growing emphasis, again, on limb preservation, sports medicine, and chronic disease management, podiatrists are positioned to make kind of that, greater impact moving forward. So it's all exciting. I'm excited. I'm just honestly ready to be finished with classes. I ain't gonna lie.
Yeah.
It gets better, George, I promise.
That's right. The plight of a second year student. It does get so much more fun once you kind of move out of the classroom setting. So thank you both. I appreciate that.
So talking about fun, are you both going to the ACFAS meeting in Vegas?
Yes, I'll be there.
All right, let's talk about that for a minute. You'll be gathering with APMSA reps from all the other schools. What are you most looking forward to when you go to Las Vegas in just a couple months for the ACFAS annual meeting? Kenny?
I would say just to see everyone, all the presidents again. We work intimately virtually, unfortunately, because of the long distance between each other. But we work our tails off to get things done. So it's good to see them again and go, hey, we did a lot this year, and like there's just sort of appreciation for each other. And also, I think for me, I've never been to Vegas, so it would be fun just to be in Vegas. So yeah, I'm excited to see everyone and be in a slightly warmer climate for a couple of days.
There you go. George, what are you looking forward to in Vegas?
Well, I haven't been to Vegas either, so that'll be kind of my first time going there. So Kenny and I will have to find some things to do. But overall, I'm kind of just excited what ACFAS represents for foot and ankle surgery. It is the biggest annual gathering for surgeons and clinicians with different types of sessions on like advanced surgical techniques, biomechanics. So it's kind of nice to be able to be in a place where innovation, mentorship, professional growth all kind of come together, and it's something that I'm really looking forward to as I continue to experience podiatry and grow in this field. So yeah, pretty excited, honestly.
That's fabulous. I'm looking forward to it. I look forward to seeing you there too.
And that in-person part is such a, Kenny, you had mentioned this. It's wonderful that we can meet virtually and interact and engage with each other, build things. But there's something about that in person where you actually get to connect in real life, and having that opportunity to do it with each other, but also then with residency programs and residents and fellowship programs. I mean, it's a really wonderful thing to have those in person. There's only so much a virtual connection can sometimes do. That face-to-face really does carry so much value. So yes, we will be looking forward to hopefully seeing both of you face-to-face, not too long from now.
Yeah, it's coming up quick too. I just realized that.
Well, the other thing is if it's your first time to Vegas, it's going to be outstanding because the meeting's at the Venetian, which is one of the most beautiful resorts on the Strip there. So you're going to have a blast. And
it's during the week, so you'll have some time before you have to sneak away to maybe experience the whole Vegas thing. I can only do about 48 hours in Vegas before I'm like, I'm tapped out. I'm done. Maybe I'm just broke. That might be it. But I'm just like tired of the whole thing. Right. I'm ready just to go back to bed. Maybe I'm old and boring.
Should we do some rapid fire?
Let's do it.
All right. So after a long week, you've had an exam, what do you like to do with your classmates? Is there a place you like to go or an activity like you like to participate in? George?
Volleyball. That's the biggest one I do. Part of the intramurals, play some volleyball. We'll hit the gym, play some basketball too, but we have our games scheduled and we try to do it after exams. So that's always a good downtime.
Oh, I like that. Kenny?
I think just hanging out with some of my classmates at like a restaurant, just like talking to each other. That's about it. That's usually what we do recently. So
I have a question for you. Like, does your class like put the exam on the back burner, or when you get together after an exam, do you start talking about questions?
Oh yeah, that's yeah, that does happen. Yeah, we try to like kibosh it, but usually it's about a good 10-15 minutes before sports comes up or something else comes up. But it's definitely like mingled, like and meshed into our conversation. Is like, what question did we get wrong? What are something like that. So.
Yeah, I think that's human nature. In fact, I would have been surprised if you said, yeah, we all just forget about the exam and get on with life. So, all right, Joe, your turn.
I love that you guys take that moment to celebrate, though, because again, you got to celebrate the small wins along the way, or at least the small milestones. If you didn't feel like it was a win, again, we focus on the next one, but you can focus on the fact that that one's done and we're moving on, right? So that actually brings a beautiful segue into food. Again, as a prospective student, we love to know what's your favorite place to eat locally, or what's your favorite kind of food to go get? George, we'll start with you.
So I grew up in an Egyptian household, so I'm gonna have to shout out my mom. Best food, best Egyptian food you can have. All right, nothing beats what is sold outside. I would love to invite you one day. So I try to learn kind of all the cooking because being in Iowa and being 16 hours away, it's a little bit tough when I'm not eating mom's Egyptian, beautiful, warm food. So, and my favorite dish is, it's something called golej, which is kind of a pastry with kind of like cream cheese, feta cheese, spinach kind of paste that's kind of, blended together, and you kind of just cook it. And I think you put like eggs on the top to kind of make the pastry a little bit, and then put it in the oven, and just the best dish ever. So that's my go-to.
That does sound good. Yeah.
Joe, something tells me that the Egyptian food in Des Moines doesn't match your mom's, George.
Do they even have an
No.
Egyptian? I'm trying to think if we even have Egyptian. I don't know if we have Egyptian specific.
I don't know that we do either. I haven't been to one
Yeah.
anyway.
So I would imagine that might be a little bit more of a challenging spot. I'm even trying to think when I was in San Francisco if I knew of an Egyptian restaurant, and I knew a couple other smaller country, and not that Egypt's not a small country, but I knew some smaller countries that they had Eritrean and some kind of Eastern European. But I don't know if I ever can even think of an Egyptian restaurant that I
It's
can
kind
think
of
of.
like blended. I mean, it's Mediterranean food, and I know like we learned this in medicine. Mediterranean food diet is the best
Yeah.
to be on. So,
Yeah.
again, it's something I grew up with, and it's kind of, I guess if you go to a Mediterranean place, a lot of it, people think Mediterranean, they think Italian, Greek. They don't really think Egyptian, I guess. But I always say this: the Egyptians started it first. That's all I want
There
to
you go.
say.
I like
I
that.
love it.
There you go.
Everyone else is an imitation.
Exactly.
All right, Kenny, how about you? What kind of food are you wanting to get after your exam? Where do you guys go to
So
unwind?
I grew up in New Jersey, so I'm a big pizza head, but also love Chinese food. So recently I found this spot called Fang's Pizza in Des Moines, Iowa, where it's a fusion of like, legit Chinese food and pizza. So
Your two favorite things.
yeah,
Wow.
it's actually not too bad. It's pretty good actually. So I
That's
was thoroughly
awesome.
impressed. Yes. So it's yeah, I again back in Jersey we had a mesh of again multiple cultures of different cuisines. So I grew up with West Indian food, various Chinese restaurants. So but I always went back to pizza and Chinese food. So it's good to see that as this restaurant Fung's here. It's pretty good.
Yeah, that's fun. That's a fun fusion idea.
Mm.
So Kenny, before we close out, I just wanted to piggyback on something you said earlier and kind of tell a funny story. So we had a student and his family came to Arizona because he wanted to go to podiatry school. And in my office, his family was there, and he said, what should I do to prepare? I'm ready to study in advance. And I said, nah. And I said, why don't you just load up your backpack and go to Europe and, have a great time and recharge your battery and come here ready to go, ready to work. And his mom said, I can't believe you just told my son to go to Europe. But you're right. To your point, Kenny, you got to rest up. You got to come in ready to go.
Just rest. Just have your fun and enjoy
Yeah.
it. Go out with your family and friends, and then just lock in.
So you're on the semesters at Des Moines, correct?
Yes.
Semesters. We're on quarters.
They're like quarters.
Yeah. So and I always tell students, there's a time to work and there's a time to play. And after the semester and quarter in our case, you work hard at our school for 9 weeks and you get a week or two to kind of recharge the battery. So maybe that's a segue, Joe, for my next question. What do you guys do to recharge the battery and relax and get ready for the next round of exams or clinicals or whatever? Kenny.
Oh, okay. I'll start off. So for me, like again, former athlete, so I love lifting weights. I love to lift. So I have the future goals of playing and practicing Muay Thai, fighting, and or like bodybuilding. So that's one of those like long-term goals. After years, just gonna take some time. So just like to focus in and just like the gym is always a therapy session for me. So it's a good. I can during this like the sessions of like school, I have like maybe 60 minutes or 45 minutes to go. And then once I get the break, I'm like, oh, I get to go in for 3 hours and punish my body, So this one of those like long therapy sessions where, I lift heavy and I go home and I just, relax and I feel, that's my second home is a gym. And then lastly, obviously, is come home to my wife and dog, and just relaxing with them.
So I have a question for you, Kenny. When you were playing football and did you say left tackle?
Yes.
What was that transition like to go from being so active and being part of a team to having to study all the time? I mean, did you have to consciously like cut down your caloric intake, or how'd that play out?
No, I mean, obviously I'm still huge, so I'm like, I still have the same caloric intake kind of, but it's a process where it's not as, the food is not in a huge abundance because you're not going to practice for hours. You're not going to study hall, then you go into weights or however it goes about. But it's just an adjustment where it's like, okay, the time management is not based off your coaches texting you or making sure you're in, study hall or going to classes. It's more like, okay, you're more on your own And I just basically tailored it to there for grad school. So it was pretty easy of a transition. I think it would have been harder if I just went to the workforce a little bit. But now that I went from undergrad to grad school at the time, it was like, okay, I just kept the same process, but instead of having that 3-hour practice window, I had a 3-hour lifting session. So little things like that.
You can't get the time management out of your system once you've been in
No, it's
sports.
unfortunately, yeah.
Okay.
No, it's
George,
good. It's good.
It's awesome. I love it.
It'll
George,
serve
what do
you
you,
for the rest of your life.
absolutely. George, what do you do to recharge the battery to relax?
I would say I go to sleep, to be honest. take some nice big naps,
Yeah.
But I try to be very, intentional about kind of resetting both the mental and physical part, because sometimes, you will burn out, you will feel like you're mentally exhausted. So one key thing I do after an exam, I don't look at any screens, I don't look at any future lecture, no notes, no nothing. If I take a nap, hit the gym after, spend time with friends that night. And sometimes I think the biggest thing, go outside. If the weather's great, go for a walk, get some sun, hear the birds. You don't have to be listening to, professors or anything. Just hear some, nature. So that's kind of like the biggest thing for my recharge, to be honest.
I think another thing I'll add in for recharge is, and I did this after, especially first year, after every 2 weeks of the block period where we had an exam, is I actually went to therapy. I actually sat down, went to therapy, and discussed like a night. I think anything was going wrong. I just processed what went on this week, whether it was family or whether it was for school, and just like I got it all out, as thoroughly as possible. And then like, okay, that was like my word vomit or like the over processing, overthinking out after the exam, and then I just get prepared for the next one.
Oh, I like that. Very good.
And George, they have now shown with lots of studies how important sleep is. And I think Jeff or Dr. Jensen, a lot of students, that's like the first thing they cut when they're like, oh, but I got to cram for this test.
Yeah.
And we also know for your long-term memory and the kind of in between of short-term and long-term, which is really what you need as a student, it's so important to make those connections and repair your body while you sleep. So I fully endorse and validate you on your sleep.
Go to sleep. I said that
Go
to
to
the
sleep. That's right.
orientation.
Take a nap. It's very valuable.
Go to sleep. Don't cram nothing. Go to sleep. That's all the 4 years. So,
Yep.
So how many hours of sleep do you get a night, George?
Before an exam, probably not as much, but throughout, I'll say 8 to 9 hours, to be honest.
Oh, very good. Kenny?
Yeah.
about 7 to 8, maybe.
Okay. Joe?
So I've actually been working. So this, as a student, I prioritized sleep because of the part of memory that was so important, but I was also not working as a student. And then my sleep went, residency kills you for sleep. And then being a faculty at a residency program, that just continued, right? It doesn't change. Then I became a parent, and that's way worse than being a resident. So honestly, the last like 5 years, Steve and I, my husband and I, have been really focused on sleep hygiene. And so I have been tracking my sleep, and I get between 7 and 8 hours of sleep.
Oh,
Yeah, it's been a key health priority for us in our house. And I have to tell you, I'm a much better human than I was 5 years ago because of it.
like that. I've got this internal clock and I get 8 hours. It's almost like I go to sleep and I get up 8 hours later, and it's just crazy.
Yeah.
And we've never talked about sleep on Dean's Chat before. So this is fabulous.
So important.
Very, very good. So Joe, one of the things that when we interview students from the colleges, I always feel like our profession's in good hands.
Oh, absolutely.
All right. Any last comments, Joe?
No, thank you both so much for your time. We know how busy you are, especially this time of year where everything's starting to wrap up. And we just really appreciate you coming to share your perspectives and experiences, and look forward to meeting in real life and connecting at the ASC.
Yes, thank you for having us. Honestly, seriously, it's been a great conversation.
Absolutely.
Thank you. And we're looking forward to following your careers too. So great work. Well, to all of our listeners out there, if you're listening on Spotify or Apple, please give us a 5-star rating, or better yet, even leave a comment or two. And if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in the profession and future leaders in the profession, like Kenny and George. So cheers, everybody. We're going to be sending you a Dean's Chat mug, Kenny and George. Your beverage of choice, of course, morning or night. Of course. So cheers, everybody. Bye-bye now.
Cheers.
Cheers.